Good afternoon. Myself, Mr. Naim Delvey, and he is my father, Abdul Rehman Delvey. We have been visiting this hospital for past 20 years. We have been meeting with Dr. Ratna Nayak. My father had a heart issue. He used to have this valve replacement 20 years back, and later on he started developing breathlessness. So we visited Ratna Nayak, and Ratna Nayak along with Dr. Puneet sir, Varma, we were able to come to a conclusion that his valve has to be replaced. So Dr. Puneet sir was very encouraging. He supported us. He told it's a minor process. You can go ahead and do the process.
This patient presented to us a couple of weeks back with acute shortness of breath, and he was not able to lie down. He was too symptomatic when he came to us, and he had history of undergoing a surgical aortic valve replacement way back in 2007. Now, when he presented to us, he was so sick that he had to be admitted at that point of time. We evaluated him and found out that his valve had failed, and he had severe restenosis along with regurgitation. So our plan was to do a CT TAVI protocol or CT of the heart. So the challenge was he was in renal failure as well. His creatinine was very high. So what we had to do was to give him fluids, little bit of fluid, and then diurese him as well because he was in failure as well. So we managed him medically and then sent him for a cardiac CT, in which a dye which was used, which is relatively less nephrotoxic, and we used minimal dye and got his CT done. Once the CT was done, we analyzed the CT and found out that his valve has totally failed, and then thought that going ahead with TAVI would be a better option, and we decided on using a self-expandable valve. So we took him up for the procedure. We did not use even a single drop of contrast during the procedure, and used the previous surgical valve as the landmark for our TAVI valve implantation, and went ahead and deployed the valve with absolute precision and utmost safety. And post procedure, the patient recovered within 24 hours, and he was up on his feet within 24 hours, and he went home walking after 48 hours of post procedure.
And once, inshallah, after the process was done, my father, breathlessness and everything has come to a normal thing, and everything, we are happy and very grateful after God to him.
After the procedure, I am very fine, and the breathlessness has come down. I can walk easily, and I am very grateful to Dr. Ratna Nayak and Dr. Puneet Varma.